Hi, I'm Dr. Renee Kunkel, physical therapist.
And hi, I'm Dr. Bianca Madrigal, physical therapist at Balance Physical Therapy and Human Performance. So today we're going to go over some of our male anatomy. And the reason for this is because we want to talk about the prostate. So the reason why a lot of men don't come to us until they have a prostatectomy is because of the shape of their urethra. So here's the bladder, and it's this big old balloon looking thing over here, and here's your prostate. As you can see, the urethra has to run through the prostate in order for it to go out and be able to relieve yourself. There's usually nothing going on with that unless there is some sort of surgical intervention there. So once we remove that prostate and that urethra has had to go through some surgical trauma, then most of the time men will come to us with incontinence. And the reason for that is that now this angle where the urethra comes out and the integrity of the urethra have been in turmoil. So now the idea is to allow for us to assist with the healing process and re-educate your pelvic floor on how to support that area so that we can definitely work on being able to be more continent. So talk to us a little bit more about what it is that we are going to be doing in order for us to help with that.
Sure, so I'm going to add a little bit to what Bianca said. So you can think of the prostate as kind of like an extra door. So for both men and women, we have a urethral sphincter that helps prevent urine from coming out before we want it to. Men have a second door, the prostate, which is why if you have, before you have an inflamed prostate, the prostate is larger and then it can become too much of a door where it's actually closing the sphincter too much, preventing urine from coming out. So that's the opposite. So like Bianca said, when post-prostatectomy, you may be experiencing incontinence. So what we do is we work on getting those muscles of your pelvic floor stronger to help support that sphincter that stops the flow of urine from coming out before you're ready for it to do so. So again, we're looking at things like how well are you able to do a pelvic floor contraction, also known as a Kegel. Men absolutely can do one too. We have very, very similar anatomy. And we need those muscles coordinated well enough so that you can help prevent that leakage. So for men, a common question we get was, how do you treat men in the pelvic floor? So typically it is an anal assessment, and it's very different than when you get your prostate checked. I promise you, it's not nearly as bad. But again, we're assessing those muscles on how well they're able to move, how well you're able to coordinate, how strong they are, how much endurance do you have. And then it's really a whole picture. How's your abdomen, your abdominal muscles, your back muscles, your thighs, your butts, your hips? How are all those things contributing to help support your pelvic floor so that it can work how it needs to? So if you're experiencing incontinence post-prostatectomy, come see us here at Balance Physical Therapy.